Good afternoon. We've come to an ending of a very inspiring CAPHRI Day. And we, of course, end with the biggest event, and that's the CAPHRI Dissertation Awards 2022. And it's my honor to present to you the chair of the committee who looked at all the dissertation awards. That's Professor Hans Maassen. Please, the floor is yours.
First of all, ladies and gentlemen, it's a great pleasure to me to be back here, because it was 9 years ago already that I retired, between quotes. I'm still working very hard in the field, but nevertheless. And I was invited by CAPHRI, and it is my great pleasure to present the CAPHRI Dissertation Award on behalf of the award committee. All research lines were invited to send in a nomination, and 5 lines did so. These are the names of the candidates. Stefan Elbers, Volker Hackert, Svenja Petersen, Katja Sion, and Carlijn Tonen. I know that the 2 men are here, and that the female candidates are online and follow this online. As you can see, the dissertations covered a broad range of topics, which made, I cannot already give away, our job anything but easy. The award committee consisted of 3 persons: Professor Sandra Beurskens, she could not be here today, and Professor Ralf Möller from Düsseldorf, and myself. And the committee was supported by Hanneke Trines of the CAPHRI office. As I already said, making a choice and designating a winner was a complicated affair. All dissertations sent in were of high quality, and all dissertations studied a relevant health problem. The award committee also received extensive letters of supervisors to support the nomination of their candidate. But the most difficult problem for the award committee was what I call the apples and oranges problem, because the research topics widely diverged from a model of quality of care in nursing homes to understanding sunburn problems, from underestimating Q fever to treatment outcomes in interdisciplinary multimodal pain treatment and treatment of peripheral arterial diseases. So, a wide divergence. After a intense discussion, I can say, the award committee chose unanimously for the dissertation that, in its view, was not only the most original one, but also a study of great societal relevance, certainly, and now I'll give it away, in the context of the experience of the COVID-19 pandemic. The winner of the CAPHRI Award is this was not intended, huh? And the winner is Volker Hackert. Who wrote with his dissertation, Mapping Underestimation of Q Fever, Insights from Major Cross-Border Outbreak in the Meuse-Rhine region. Let me briefly explain the choice of the award committee. We had a number of arguments. First of all, the study rests upon a truly natural experiment. That's not often possible, but in this case it was possible. Second, the study combines medical, veterinary, and environmental expertise. And in doing so, the study is based upon what is called nowadays a One Health perspective. Third, Dr. Hackert has used a range of innovative methods ranging from epidemiology, microbiology, cartography, and information science. And fourth, the study offers important lessons for disease control. Because what follows from the study is that the detection of only a few cases of Q fever can be highly misleading. Dr. Hackett demonstrates that the outbreak of Q fever was actually grossly underestimated and that pathogens do not respect national borders. A handful of notified human cases may signal hundreds of or thousands of unreported infections, but that may be missed by established surveillance systems. So for this reason, public health authorities should set up cross-border surveillance systems to manage and monitor the spread of pathogens. And last but not least, the lead article, the key article in the study was published in a journal with a very high impact factor. I'm almost ready. So all of this together, in the view of the committee, these are convincing reasons to congratulate Dr. Hackert with his wonderful, insightful, and relevant dissertation and reward him with the CAPHRI Dissertation Award. Thank you. So may I invite him? It's not just words, huh? Oh. You got it?
Thank you. Thank you very much.
Excuse me, could you please look at me for a second?
Yes.
Show me the prize, please. Very nice.
Just.
Thank you. Nice smile. You too, sir. Thank you.
Thank you. Well, dear members of the jury, I feel deeply honored by your decision, by your judgment. I must say, I didn't expect this judgment, and I'm
Really?
I'm really, I'm very grateful, and as I said, deeply honored by your decision, and I hope that, well, my dissertation will live up to its purpose, will, well, show that infectious disease control, and especially our task as infectious disease control doctors, is really important, as the pandemic has shown, which strikingly had some parallels to the Q fever outbreak in the region. When I started with the Public Health Service South Limburg in 2009, for me, it was just a stroke of luck that I was faced with this outbreak of Q fever. Of course, for those affected by Q fever, it was a major issue, and I think for many of them still is a major issue. And the value of my dissertation, I think, is to honor those people who contributed to my dissertation, and to honor those I'm writing about, those who were affected by Q fever. And it's also, in a broader sense, honoring those who are suffering infectious diseases without being acknowledged or recognized as such. So I'm very grateful, honored by your decision. Thank you. Dank u wel. Van harte bedankt.
Okay. Well, so.
Thank you, congratulations. I also would like to thank Professor Marse as chair of the committee to judge.
Self-appointed chair. Huh?
So, well, I can assume how that process went, but thank you for that, and thank you all the other members of the committee who assess all the PhD quizzes. Thank you very much.
Okay, thank you.
Yeah. And now a final word of thank you. Thank you all for coming. Thank you for being here. Thank you for giving the workshops. As you can see, a lot of people worked hard during the workshops to lead you through this CAPHRI Day, but also behind the scenes. And I would like to ask Hanneke and Chantal to come to the front. Because without them, there would not be a CAPHRI Day, or it would be maybe a small CAPHRI Day. So please, and give them a big applause, because thanks to them, we can have a CAPHRI Day. Well, thank you all for coming. This is the end of the CAPHRI Day. Not really the end, because we have a drink. So enjoy, have a drink, and have a safe travel home. And see you next year at the CAPHRI Day, or maybe at any of our other events. And we plan to have the CAPHRI Day in summer or in spring, because a lot of them said it's a better season than November. So next year, again, in a sunny environment, I hope. See you. Thank you.